J Pharmacy, and look, I'm back with another video. I've been on a long hiatus, however, I am back in 2024. I think I'm gonna, start being consistent on my YouTube, trying to make it more medical content, medical pharmacology videos, so you guys can follow along and listen and learn. But here today, I'm just going to talk about pharmacy school, right? And my experience in pharmacy school and what I've done, how I did it, my recommendations, my insight, and just for people who want to know what pharmacy school is, if you're thinking about pharmacy school, or current medical students, current dental students who just want to know how pharmacy school is and the curriculum and how tough it is, right? I'm just here to give you insight. And just a disclaimer that all of these are my own opinions. This is not in no way, shape, or form reflective of the pharmacy school that I went to or my employer. So these are my own expressed ideas, concerns, and opinions. So without further ado, let's just hop straight into the video. Pharmacy school, man. Shit is tough. Like, it was super tough. So pharmacy school is either 3 years or 4 years, depending on the school that you go to. Super cheap or super expensive, depending on the school that you go to. For the most part, most people are going to end up in about $200,000 with accruing interest in pharmacy school. But pharmacy school is definitely worth it, man. I would definitely say it's worth it. I have been in pharmacy as a profession for about 9 years prior to me going to pharmacy school. So this is not something that's brand new to me. I've been in this, this profession. I've been in this niche, been in this field for a very long time. So I know what it's like. I know what I was getting into. But pharmacy school, let's just get straight into it. Your first year is really a bullshit year, honestly. It's really, and I'm also, let me go back. I'm here to give you guys the realism. I'm here to give you guys the reality. It's a time to be professional, obviously, when I'm, doing my work, being a doctor, whatever. But it's a time to be authentic and appeal to your audience and give people the realism behind everything, right? In this video, I'm giving y'all the realism behind everything. So if I curse, it's just what it is, bro. I'm being honest. I'm trying to connect with you on a deeper level. But yeah, your first year, your professional year one, your P1 years, what it called, it's bullshit. It's just part of the curriculum to keep the school having accreditation, right? Accreditation. So really your P1 year is just your weed through year. This is where a lot of people find out that this pharmacy school is for them, find out that the pharmacy school isn't for them, or they fail out, they get kicked out for whatever reason. This is the year where, half of the year, well, your class is going to start, start out strong, but throughout a couple months, you start taking those exams, and they're just going to dwindle down. So it's a lot of introductory things, a lot of introductory to pharmacy topics, but you don't go into great detail about it, just get introduced to it. Like I said, this is just a weed through year to see who breaks. So topics include like biochem, not so much physics. I don't really know why we take physics. We don't hardly ever use physics. I would say the most important is chemistry. You definitely need to know a lot of chemistry going into your P2, P3 year. But chemistry, biochem, because you have to know how ions work in your body. We have a lot of electrolytes, right? We have a lot of sodium, potassium, calcium, a lot of exchanger pumps to influence our electrolytes within our body. So it's definitely worth knowing. But your P1 year, like I said, you get introduced to topics, but nothing really sticks in P1. It's just they have to have that as part of their curriculum to stay accredited. That's how I see it. So enough with P1. Your P2 year, your second year of pharmacy school, your second and third year is where you go heavy in the clinical side of pharmacy. So the clinical side being your disease states, being your clinical guidelines that we follow, that we are guided by, a lot of journal clubs, a lot of reading literature, a lot of professionalism days, professionalism activities, a lot of volunteering, a lot of OSCEs. So you guys know what the OSCEs are for my medical students and my dental students. Um, just a lot of clinical based stuff. So your P2/P3 year, depending on your 3 year or 4 year, like I said, this is where you learn a lot of your clinical stuff. So every body system that we have has a disease state process that can go wrong, and it has a guideline that we all follow in the United States, right? So for example, if you have hypertension, that's a common disease state, hypertension, right? Heart blocks, anything, arrhythmias, anything that has to do with your blood pressure, your heart, we have guidelines that we follow, and they're called the American College of Cardiology, or the Heart Failure Society of America, or American Heart Association. Like, these are the three entity guidelines that we follow uh, to provide standard of care when it comes to whatever disease state, right? So you have to learn all of your guidelines, what can go wrong, the pathology, the disease state, and the treatment, right? So we have to know all of that. And this is why I say pharmacists are the second smartest type of doctor there are behind physicians. And let me explain it before people get into the comments expressing their opinion. We all know that doctors are like the top echelon. Nothing is higher than a physician, right? But every physician, when they diagnose, they have to have SOAP notes, right? They have to have subjective, objective assessment and plan. Usually in that plan, it's always a treatment. So whatever disease diagnosis that you're diagnosed with as a patient, there are treatment options for it. So if there are treatment options for it, there are both non-pharmacy related treatment, which is lifestyle changes, and there are pharmacy related treatment, which are drug treatment, right? So for example, I don't know, a typical disease, say diabetes, right? Something can go wrong with diabetes, they give you insulin, okay? It's typical treatment. As a pharmacist, we have to know almost every disease state that a physician has to know. There are drugs tied to that specific disease state. Okay, there are far more drugs in this world than there are disease states. And so that's why I said, when it comes to just purely disease state, treatment plan, and the pathology of diseases, pharmacists are equally as smart as physicians. Now, where physicians are superior than pharmacists and everyone else is when it comes to procedures, when it comes to doing surgery, okay? When it comes to things like that, that makes them far more superior than us, because we're not trained to do that in pharmacy school. We're trained to, understand the disease state, understand how it's diagnosed, understand what can go wrong, understand the treatment, understand the maintenance phase after the disease state to make sure they have good a life after the event. So when it comes to just pure knowledge on everything, pharmacists definitely are up there with physicians. Like I said, they are far superior than us when it comes to doing any type of procedure and any type of surgery. We simply just do not get trained in that area, right? That's not our expertise. Our expertise is drugs. So in that same sentence, you can say that we are far more advanced than anybody, including physicians, when it comes to drugs and drug therapy, pharmacology, and how do drugs work when we give it. So it's like a balanced effect, right? Your P2 year, your P3 year is really the bulk of your clinical year. This is where you're gonna learn everything clinical related. Your fourth year or your third year, depending on your 3-year program, your 3-year program, your third year is your final year. If you're a 4-year program, obviously your fourth year is your final year. And your fourth year, I would say, is your hardest year. And I say that because now you're on the spot. As like you're on the spot is because you're rotating. We have rotations all year round, and you are at liberty to get asked consultation. You can't rely on your notes. You can't go back through your paper notes, through your computer notes. You can't do that. Like, you are expected to know a lot of shit that you learned in school. Like, you are expected to know this now. Obviously, you can make mistakes. Obviously, it's okay to not know because you're still a student. But in your fourth year, you are at liberty of getting asked for consultation, getting asked to present this patient, getting asked for your expertise or your opinion. So your fourth year is your most difficult year in my opinion. And I say that because now you have to do 40 hours a week typically for a whole year straight, Monday through Friday. Okay. The bills don't stop. If you just single, you don't have help from mommy and daddy, you don't have help from, your significant other, you really doing this on your own. And if you have kids, like it can get very difficult. You need money coming in to sustain, right? And it's going to cause you to either fail or get a job, and it's going to put more stress on you. So your fourth year is your most difficult year. In my school specifically, it's a 3-year program. Our third year is our technically fourth year. It's a 3-year program. So our third year is our final year, and we have to go on 8 6-week rotations, which equates to about 48 weeks. And then we know 52 weeks is a year. So 8 6-week rotations is just rotation, 40 hours a week, Monday through Friday. We get the weekend off, 40 hours a week, Monday through Friday. We get the weekend off, 40 hours a week, Monday through Friday for a whole year straight until we're done. So, but I know other pharmacy schools, their fourth year, they have to do 1-month rotations for a whole year. So 1 month here, 1 month here, 1 month here for a whole year. Regardless of how you do it, the shit is stressful. But man, pharmacy school is tough. I almost failed out my first year. I came into pharmacy school. I really didn't like think much of it. I was just here, My first year, the reason I failed because I was trying to figure out how to study. I was trying to figure my groove. I was trying to figure out how to compress all this fucking information that was presented to me. Because in pharmacy school, we don't have books. Well, my pharmacy school, we don't have books. Everything is purely taught in lecture from a PowerPoint slide. So we make our own notes. We have access to the online database, but as far as hard books, we don't have. So our typical lecture day consisted of about anywhere between, I would say about 600, let me do the math. Because a typical lecture day, it ranges between, at the bare minimum, 60 slides to about 150 slides. So between 60 and 150 depending on the topic. So let's just say a middle ground is 110 slides. 110 slides every day for about 9 days, because we learn Monday through Friday and then Monday through Thursday, and then we have an exam on that Friday. So 9 days, so 110. So 110 times 9, that'll be 900, almost 1,000. Let's just round it to 1,000. 1,000 slides every 2 weeks, and we have lecture material every 2 weeks, and we have an exam every other Friday. So that's on average, okay? Some days we have slides that's less than 100. Some days we have slides that's more than 100. It just depends on the topic. But on average, it's about 110 slides for 9 days, Monday through Friday, and then Monday through Thursday, and then we test. So it's a lot of material, and I was trying to figure out how the fuck do I study? How the fuck do I arrange this stuff? Trying to balance that, trying to balance making friends, because you only go to medical school once, you only go to pharmacy school once, dental school once, so you're trying to make friends and trying to live life in Vegas. I'm in a new atmosphere, trying to gamble, trying to meet people. I was trying to, on top of it, I'm working almost 40 hours a week, so it's I'm trying to balance so much to the point where when I took my third exam in school, I failed. Took my fourth exam in school, I failed. So I was damn, I gotta get it together. And if you fail more than 5 times, then they have to academically withdraw you from the program. And at that point, I was early on in my pharmacy school career, and I was man, if I don't tighten up now, I'm not gonna make it out of the first semester. I'm not gonna make it to December. So yeah, ever since then, I didn't fail another test. I made it through. It was very fucking difficult. And I'm not gonna lie, do not go into pharmacy school thinking that it's super easy, because it's not. it definitely takes discipline. It definitely takes hard work and studying. I'm not going to lie. Discipline, studying, and that's really it. Discipline, studying, time management. But I'm pretty sure it's like that for every other like school, right? Um, a relationship in pharmacy school is not advisable, but I have seen it work. It does work if your partner is someone who is in school too, because they understand. But your relationship is definitely going to be tested if your partner just not in the medical field, because they don't understand. Like, you gotta put this time in and study. Like, you gotta put this time in to make flashcards, notes, review. Like, you just have to. And then you have to be there for professionalism days. You have to be there for OSCEs. You just have to be for volunteer. Like, you have to be there when they incorporate these things that are mandatory, right? And it's definitely time consuming. But pharmacy school, yeah. If you guys have any questions on anything, feel free to drop a like, drop a comment in the comment section. I'm gonna do my best to reply. I'm gonna make another video on should you do a residency as a pharmacist and my humble opinion on that. But yeah, be on the lookout. But yeah, if you're bored, just look at some other medical videos that I created, some pharmacology videos to help you guys learn about drug pharmacology, trying to make it easy for you guys. But yeah, I'm back in 2024. I'm trying to get this YouTube channel popping and pay off these loans with YouTube money. So yeah, you got any questions? I'm here. Holla at your boy.